Good afternoon. We are honored to share our work, Centering in the Margins, Advancing Health Equity in Pediatric Palliative Care. We are Hailey, Erin, Hailey, Elena, medical students here at the university. Dr. J. Meg Carbea and Dr. Kalia Johnson were the principal investigators for this research. Many people assume palliative care is end of life. While that's a component, palliative care focuses on management of pain, support of caregivers, and the coordination of the care team. These services attend to the medically and socially complex needs of pediatric cases. Palliative care teams are interdisciplinary, and their care services are often incorporated into the treatment of diseases such as chronic kidney disease, HIV, AIDS, and sickle cell disease. Since healthcare reflects the disparities and discrimination present in society, racism both within and outside of the healthcare system may influence whether Black and Indigenous people seek or receive palliative care services. Structural, interpersonal, and internalized racism have contributed to decreased access to primary and subspecialty healthcare services amongst Black and Indigenous people. These groups report lower quality satisfaction, communication, and pain management when receiving care.
As clinical researchers invested in advancing health equity, we recognize that more data is needed to understand how racism uniquely impacts the lives of pediatric patients and families throughout the illness trajectory. To address this, a three-part project was undertaken, beginning with the scoping literature review, which we will discuss today. The findings will inform one-on-one interviews, consensus recommendations to an advisory board focused on creating more equitable practices and policies in pediatric palliative care. The overarching aim of this project was to understand, for Black and Indigenous patients and caregivers, what is the impact of racism, including discrimination and racial bias, on access to and experiences of palliative care. The scoping review was conducted based on a keyword search developed by librarians at the University of Minnesota and Emory University. We included qualitative and mixed method studies of pediatric patients with serious illness in the United States with explicit mentions of racism. We screened 2,700 papers, and through abstract and full text review, only 6 papers met our inclusion criteria for extraction. Most of the papers did not make explicit statements about racism and the impact that it has on patients. Additionally, there were no studies focused on Indigenous patients and families.
We are in process of conducting the meta-analysis for this work, including an analysis of the forms of racism described within these papers, as well as the descriptions of palliative care domains that they refer to. We identified overarching themes amongst these 6 papers regarding families' experiences with palliative care and racism. First, we found that of the 6 papers, 5 focused on experiences of children and families being cared for in the NICU and PICU settings, which is neonatal and pediatric intensive care units, and 1 paper focused on the experiences of children living with HIV as well as their caretakers. Secondly, and perhaps even more importantly, Black patients and families recognize disparities in the type of emotional support, health communication, and power over decision-making they experience during this time. These papers found a disparity in the utilization of palliative care along racial lines, with white families accessing the care much more frequently. One parent very sadly noted, "My fears and apprehensions were not acknowledged, and there wasn't any compassion there. I said, I don't know if you would do this to me if I were a married white lady. Even if you have those feelings deep in your heart, you shouldn't be bringing it outside."
Third, there is a lack of research specifically exploring the experiences of fathers and siblings. Finally, caregivers more frequently identified institutional racism than interpersonal or internalized racism in their experiences. A separate paper noted that Black friends said they will never take their child there to the children's hospital. They just kept saying that it wasn't the best hospital to take your kid. They don't think that my infant was getting the best care. So maybe they would look at it like racism. Through the scoping review, we've identified a gap in the literature explicitly exploring the impact of racism on pediatric illness, which will inform the next arm of this research. We hope that this work will not only highlight the existing disparity, but that its impact will help alleviate its effects on patients and their families. This work has been supported by the Cambia Health Foundation Sojourn Scholars Leadership Program. We'd like to thank and acknowledge our lovely mentor, Dr. J. Meg Carbea, we've learned so much from her, Dr. Kalia Johnson at Emory University, Karel Nakumara from the University of Minnesota, librarians Shonda Hunt and Hannah Rogers, who helped with our keyword search, Camille Murray from Emory University, as well as Dr. Dio Cavaliertos from Emory. Thank you so much for taking the time to listen to our work, and we're happy to speak with you after these presentations.